Hi everyone, so today I wanted to talk about Accutane, that I am going to be taking Accutane soon, and I thought it was just no big deal, just another pill. I used to take antibiotics, so that's what I thought it would be like, but it's very serious, taking Accutane, and it's very expensive too. Those are the things that I did not expect at all. So doing this video, I wanted to give you guys some information that my doctor gave me. So if you guys are thinking about taking Accutane, then maybe this will help. I've fought with acne for about 8 years now, and I'm just sick of it as of right now. Every year it seems to get worse, and I don't know if you guys can see, but on this side of my forehead there's a lot of, it's very sore, it hurts a lot, and right around my chin, around here, I've heard about like getting a chemical peel and stuff like that, but I just don't want to damage my skin like that. So I've asked my doctor if I can take Accutane, and she said yes, but at the time I didn't have health insurance, so she was afraid, because I used to pay out of pocket, she was afraid that it was going to be really expensive for me. So it's been a month since then, but I now have a health insurance. If you do not have health insurance, it can be very expensive. I'm gonna tell you the reasons why it will be expensive, but I just want to start off with what is Accutane. So if you guys don't know what Accutane is a form of vitamin A. It's a very high dosage of vitamin A. And basically what it does is that it dries out your skin. It sucks out all the oil that you have on inside your skin, so that no acne can occur. So you guys know that acne is bacteria plus oil, right? So if you take the oil away, there's no way that acne can form. So that's kind of like the basic idea behind Accutane. Accutane is an oral pills that you take every single day for about 6 months, and 6 months is 5 to 6 months. 6 months is like one course. So after that 6 months, there is a guarantee, there is about 5% chance of your acne coming back, but most of people, their acne does not come back. So if you're lucky, your acne will go away permanently after 6 months of Accutane. Some people take 2 courses or 3 courses of Accutane for their acne to go. I think it depends on how bad your acne is. And so that's kind of like the basic information about Accutane. So when the doctors told me about the side effects, I was really scared. The side effects are pretty serious. So number one, it's obvious that your skin will be dry and it'll be flaky. So that's kind of obvious, but it also dries out your nasals too. So you have a chance of getting bleeding nose often. And that's kind of what I'm afraid of the most, because I'm really stingy when it comes to my blood, because I don't have a lot of blood. So whenever I lose blood, other than my monthly period, I kind of feel not good. So that's that. And also it can increase or decrease your appetite. So it just depends on the person, I guess. And also you can get like depressed or any kind of like emotional stress. And also the biggest side effect is that if you are sexually active, then you need to protect yourself from getting pregnant. So I was saying that when you're on Accutane, you have to protect yourself from getting pregnant if you are sexually active. The reason is the birth defects are pretty serious, and the doctors make you sign this little booklet that says you do understand that if you do get pregnant, you have to stop taking the Accutane and if you are sexually active, that you have to use 2 forms of protection. It's not just one, it's 2. So there is a qualification of what you can use. There are primary forms and secondary forms. So the primary forms are, it's listed over here. You can get tying your tubes or partner vasectomy, and you can take hormonal pills like birth control, like skin patches or shots, and under the skin implants or vaginal rings. So those are your primary forms. So in here it says you have to have 2 different birth control methods. One has to be primary and the other one can be either primary or secondary. So the secondary forms are condom, it says cervical cap, vaginal sponge. So those are your secondary options. And the birth control limitation only occurs on ladies, and the doctors told me that, oh, you have to wait about a month before you can start, because we have to make sure you're not pregnant. They do take a pregnancy test every time you go to the doctor, and they have to do blood work every single month, just to make sure that the Accutane is not damaging your liver. So that's why it can be so expensive, because the blood work and the pregnancy test can come up to about $300, depending on what kind of blood test they need from you, or you know, it just depends on the person. And also the Accutane pills are pretty expensive too. My doctor told me that it can start from $500 up till $1,200 just for a month of supply. Maybe I didn't understand it correctly. Maybe it's for the 6 months course, but even if it was for 6 months, $500 to $1,200 is a lot of money. So to save money, you can have health insurance, or you can enroll for one, or there's another program. It's Promise Assistance Program. So what you do is you call the Promise Assistance Program, and they have you send your tax information or your parents' tax information, and they have a certain qualification, and you have to qualify. And if you're lower than the average income, then they pay for your pills, not your doctor's bills, but your Accutane oral pills. So that's another option that you can take. For me, I did not qualify for that program, so I went and got a health insurance. So I'm gonna go to the doctor tomorrow, and they're gonna take pregnancy tests and some blood work, and I'm gonna be on Accutane. And what they do is they have you take small amounts at first, and then they eventually increase the amount. And every month they have to check your check if you're pregnant, or if the pills are damaging your liver or any other organs. So that's that, and that's about the side effects and the cost. But they said after Accutane you have to wait about a month until you can have unprotected sex. So you do have to wait till the Accutane gets out of your system, so that even if you were to get pregnant, the baby won't be damaged. The baby won't be in danger. So I think with this treatment you do have to be patient, and I know that it's not gonna go away 100%. You still have chance of your acne to come back. But for me, even if the side effects are very dangerous, I'm just sick of my acne, so that's why I am taking this. And I know that so many people have taken it and they are happy with the result, and their acne does not come back. So I do want to risk that. Other stuff. The doctors recommended me to take vitamin E oil or like fish oil orally to help me with my dryness, and I do need to exfoliate like once a week or something like that to get rid of my flaky skin, and also moderate my alcohol. So if you do drink on a regular basis, they do tell you to decrease the amount. I drink about once or twice a month, so they said that's fine, but I don't drink till I pass out. I just drink, you know, just to enjoy the moment. So I don't think it's gonna be a big deal. So that's that. And I do plan on updating you guys on how my acne is doing and my result. So every month I will do an update and see how my acne is getting better or worse, or you know, the reactions and the side effects. And the side effects, you guys, it's not guaranteed. So depending on the person, you might not get a bloody nose, or you might not get, you know, dry skin, or you might not get everything that they tell you, but those are the normal, like the average side effects that people do have. So it's not guaranteed. You don't know what's gonna happen. I don't know what's gonna happen to me. It can, you know, do whatever. So that's all I wanted to say. And the reason I'm doing this is because if you guys are looking into Accutane, do some research, talk to your doctor, ask your doctor. Don't be shy about it. If you are sexually active, don't be shy. Just tell them what your problems are, or you know, if you don't have health insurance, you know what you need to do to get one. And do a lot of research, and also know what you want. And it's not a joke. Accutane is not a joke. It's not, oh, I'll just take Accutane. You know, it's not. You have to think about it. You have to plan for it. You have to clear your schedule and your life for it. And I am planning on telling my family that, you know, I might be sensitive, you know, while I'm taking Accutane, because it says you can get sensitive emotionally, and you can get depressed and stuff like that. So I'm gonna talk to my friends and family that, well, if I do get sensitive, it's not me, it's the Accutane that's doing that. So talk to your family and see what they say. Talk to your doctor as always. I think that was about it that I wanted to say. So take all of the information that I told you into consideration, and I will see you guys in my next video. Bye!